Assalamu alaikum. In fact, we had a very mighty presentations this evening. The last presentation, in fact, summarized the how we should manage a patient with some kidney disease, the management of diabetes in these patients. And he has described the stages, the drugs, and the monitoring systems also. Hats off, Dr. Sudhanshu, you presented it very nicely. The second speaker, definitely, as my co-chair said, it was an excellent eye-opening gesture to the society. We have not thought about the complements in diabetes, and she has opened the chapter of complements in the field of nephrology. We have lot of things to discuss, and inshallah, as the days progresses, our society and all the community will come up with the matters of complements in diabetic kidney disease. The nephrotic syndrome in diabetes mellitus is definitely a great concern to all the nephrologists, whether it should be a diabetic origin or it should be a non-diabetic origin with the diabetes. And Dr. S. Anul Kurim has presented it so smoothly that everybody possibly realized that things has to be divided. We have to exclude first whether there is any non-diabetic kidney disease or not, and when the biopsy should be done, and what are the drugs and what are the monitoring that we should do. Just one simple thing I just want to add. While I was going through the literature, I found one interesting observations and study. As you all know that we use steroid in case of almost all nephrotic syndrome. So, but in case of diabetes, we can't use these drugs as routine in unlike other conditions. That here, some researchers found an interesting observations. They had used ACTH patch in case of nephrotic syndrome related to diabetic mellitus, which is not related to any other conditions. And they have found very interesting results that almost 50% patients had remission, complete remission of the diabetic proteinuria. So that is a very eye-opening study that I found in the literature. So these things also I just want to share with you. I am very thankful to all the my chair and my rapporteur, moderator. It has been an excellent session because of the contribution of them. I just want to hand over the crest to Dr. Maqsuda Moni, as she has managed this session very nicely. In fact, the inauguration session is going to be start very soon. Our chief guest, Professor Harun, he was himself sick, but in spite of that, he is on the way because of the heavy traffic today. It has been delayed, but we are expecting in within few moments. And I am very sorry to say that our special guest, Professor Nijamuddin, is also sick. He remained admitted in the hospital just few days back. Our president-elect of the Renal Association is possibly not coming today. So we are going to start our sessions right at this moment. Thank you, ladies and gentlemen.